Hi, I'm Nancy Culp, also known as the Prenatal Paparazzi. I'm a registered diagnostic medical sonographer with nearly 20 years of experience. And during those years, I've scanned thousands of babies and met countless excited parents. One thing I've noticed over and over again is that expecting parents love asking questions, which is wonderful. The problem is, they're often asking the wrong people. Before an ultrasound appointment, I see questions pop up in Facebook groups and pregnancy forums and neighborhood apps and text message chains and family group chats. Questions like, what should I eat? Do I need a full bladder? Should I drink orange juice? Can my toddler come? My friend said, my cousin told me. And while everyone is trying to help, every ultrasound practice has different policies, different equipment, different appointment types, and different expectations. So today, I want to save you some stress by sharing 5 questions you should ask your ultrasound professional instead of your friends. So let's jump in. Question number 1, do I need a full bladder? This is probably the question I hear the most. You'll hear advice like, oh yes, drink a gallon of water. Hold it until you're miserable. My friend had to pee so badly she almost cried. Here's the truth. It depends. No pun intended. Your gestational age matters. The type of ultrasound matters. Your provider's protocol matters. Some early ultrasound scans benefit from a full bladder. Some later scans absolutely do not. In fact, coming in with an overly full bladder for certain exams can actually make you uncomfortable and may even make it harder to complete the portion of your scan. So, instead of guessing or relying on what worked for someone else, simply ask your ultrasound office exactly how they want you to prepare. They'll give you instructions specific to your appointment. That's the answer that matters. Question number 2, should I eat or drink anything before my ultrasound? This one creates so many myths. Some people swear by orange juice, others recommend chocolate, some say coffee, others say ice cream. The idea is that sugar will make baby move. Sometimes parents get lucky. Sometimes baby decides it's nap time anyway. Babies don't read the internet. The reality is that fetal movement depends on many factors, not just what mom eats before the appointment. Some exams also have specific dietary instructions depending on why you're being seen. So before loading up on sugary snacks because someone online recommended it, ask your ultrasound professional. You may not need to do anything special at all, or your office may have recommendations based on the type of scan you're having. Question number 3, what should I wear? This sounds simple until you're halfway through your appointment wearing the world's most complicated romper. Comfort matters. Practicality matters. You'll usually want clothing that allows easy access to your abdomen without requiring you to completely change outfits. 2-piece outfits are often easier than 1-piece outfits. But again, ask your ultrasound office if they have recommendations. Some specialty scans may require different preparation than others. A quick phone call can make your visit much smoother. Question number 4, who can come with me? This is another question people often ask online instead of asking in the place they're actually visiting. Policies can vary. Some offices welcome multiple guests. Others have limits because of room size. Some allow children, others don't. Some allow video, some don't. These policies aren't there to disappoint you. They're there for safety, privacy, workflow, and making sure every patient receives quality care. Imagine arriving with your entire family only to discover the office has a guest limit. That's a stressful situation that could have been avoided with one simple phone call. Your ultrasound team wants you to know what to expect before you arrive, so ask them. Question number 5, what happens if my baby doesn't cooperate? If you've had an ultrasound before, you already know. Babies have their own schedule. Sometimes they're sleeping, sometimes they're facing your spine, sometimes they've tucked their hands directly in front of their face, sometimes they're doing gymnastics, and sometimes they simply decide today is not picture day. That doesn't mean anything is wrong. That just means babies don't always pose on command. Ask your ultrasound professional what happens if baby isn't in the ideal position. Will you walk around? Will you change positions? Will you come back later if needed? Knowing the plan ahead of time helps reduce disappointment and anxiety. And remember, ultrasound isn't about creating the perfect social media photo. It's about obtaining the images needed for your care while giving you the best experience possible. Here's something I'd really love for every expectant parent to remember. Your friends care about you. Your family loves you. Online communities can be incredibly supportive, but none of them know your appointment better than the people performing it. Your ultrasound team knows. Their equipment, their protocols, their scheduling, their policies, their preparation instructions, their expectations, and most importantly, they want your appointment to go well. Never feel embarrassed about calling and asking questions. We would much rather answer your questions before your appointment than to have you show up stressed, uncomfortable, or unprepared because of something you read online. Questions are welcome. In fact, they're encouraged. If you found this video helpful, please share it with your expectant friends who are asking everyone but their ultrasound professional how to prep for their session. You never know whose anxiety you might ease simply by helping them get information from the right source. And if you're an expecting parent, remember this: the internet has opinions. Your friends have experiences, but your ultrasound professional has the answers specific to your appointment. Thank you so much for spending a few minutes with me today. I'm Nancy Culp, also known as the Prenatal Paparazzi, and I hope this helped you feel a little more confident walking into your next ultrasound. I'll see you in the next video.